Hello, everyone, and thank you for joining us for our town hall, Managing the Pandemic, Promoting Well-Being and Public Safety, for public safety personnel and their families. This is being presented by the Canadian Institute for Public Safety Research and Treatment. My name is Emily Cossack, and I'm the Knowledge Manager at CIPSRT. I'll begin with a few housekeeping notes, and then I'll introduce you to our panelists and presenter. First, we'll be having a brief presentation on a well-being framework. We will then open up the floor to questions. Questions can be submitted to the organizer using the questions box. I will then pose the question to our panelists. When submitting your question, please list your organization or public safety sector. Now, I would like to introduce our panelists. So first, we have Alain Perron. He is with a training officer with the Ottawa Fire Services, and he is also a coordinator for the medical program and the mental health and peer support program. So if you want to give a wave, Alan. Perfect. All right, next, I want to introduce Megan Provost. She's a director of workplace wellness and employee well-being at Corrections Service Canada. Do you want to give a wave, Megan? Perfect. All right. So then I'll introduce Christine Godden. She is Assistant Coordinator Peer Support Team for the Ottawa Paramedics Service. And we'll give a wave there, Christine. Perfect. All right. And then Casey Ward. He's a sergeant with the Regina Police Service, and he's the president of the Saskatchewan Federation of Police Officers. So if you give a wave there, Casey. Perfect. And on the line, we have Sylvain Chateauvert. She is with the RCMP, and she is with Occupational Health and Safety, Occupational Health and Safety Branch, and she's the Director General there. So Sylvie, if you can say hello to everybody.
Hi, everyone.
All right. So lastly, I'll introduce our presenter, Dr. Jim Thompson, who is a research medical consultant with the Canadian Institute for Military and Veteran Health Research and an adjunct associate professor at Queen's University. Dr. Thompson, I'm going to turn it over to you to start the presentation.
All right, thank you. Yeah, so that's who I am. Good day, everybody. I practice rural and urban emergency medicine in Alberta and Prince Edward Island before I aged out of full-time clinical practice and focused instead on the well-being of military veterans at Veterans Affairs Canada about 15 years ago. And then a year ago left that, and now I'm public health sciences at Queen's University, working here from Charlottetown. I was a flight physician with STARS in Alberta many moons ago when I was younger, and I was the first physician on the first board of the Alberta College of Paramedics when it got started many years ago. I've been married to an RCMP member throughout her long service, and I was there during the SARS-1 and H1 pandemics on various front lines. So I think I get where public safety providers are coming from during this COVID pandemic, and I thank you for letting me help out this way during this challenging time, and look forward to hearing from you during this panel. I'm only going to talk for a few minutes. Sorry, I'm waiting for the slide to change here. Yeah, so I'm only going to talk for a few minutes and then turn it over to the panel. I intend to give you a way of thinking about well-being that's proven very useful in the military veteran community. Today's panel members have been using this framework over the past day or so to think about ways of supporting public safety providers and their families. So that's what we'll be doing during the rest of this panel discussion after I finish a brief introduction here. The word well-being has been in our language in English for about 400 years. It refers to a state of existing in terms of a degree of some kind of satisfactory or successful or sufficient. One can have poor or better well-being. It can be a range of things. It doesn't always mean things are going well. For the academics out there, all this is written up and there's evidence background to show where all this came from. The problem is that people understand this word well-being differently. We can't even agree on how to spell it with or without a hyphen. Different disciplines have evolved different understandings of the term and different ways of measuring it and thinking about it. But in the past 20 to 30 years, a common understanding has emerged that uses the hyphenated spelling and combines all the different well-being concepts together. They've emerged both in national and international work in this area. This is an example of one of these composite well-being frameworks, the one that was developed for veterans. We have several papers outlining how it was derived. This framework is proving useful in meeting the needs of military veterans. And based on conversations with leaders in your world, it looks like it'll also be useful for thinking about solutions to issues in the public safety communities as well. To think about this as being a checklist, it's not a measurement tool, it's a checklist. To think about what's going on in each of these various domains or our main areas of life. All right, I've got this lag issue happening here. Sorry, Emily, I'm afraid to press the button too often or get too far ahead here. Okay. This slide gives a sense of what each of the 7 domains is about. There are 7 of them. The first one, for example, is health. It's about the physical, mental, social, spiritual functioning of the individual person. The second one is about employment or purposeful activity, meaning the person is engaged in meaningful activity that confers a sense of purpose and brings resources. They don't necessarily have to be employed to do that. In terms of finances, it's about having sufficient financial resources for the self and family. And in terms of life skills preparedness, that's about being able to manage life challenges when they come along. And certainly this COVID pandemic is one of these examples of a massive challenge to everybody's well-being. But it's about having the skills and knowledge to deal with that. So we might all be having to pivot and learn new skills and knowledge. Social integration well-being is about being socially connected and feeling like people have adequate social supports in the home and in the community and in the workplace. So it's about thinking about that issue. The cultural social environment is about the norms and values of the community and your workplace. And it's about all the services and programs and benefits and legislation and the state of the economy and other factors like that that are around the public safety personnel and their family. Our well-being in each of these domains is influenced by factors in all the other domains. There's a lot of back and forth bilateral causality going in both directions here. Health, which as I said before is the physical, mental, social, and spiritual functioning of the individual, that's viewed as a subdomain of well-being. It's not viewed as being synonymous with well-being. The problem that was created by the World Health Organization 1948 definition of health, where it seemed to be synonymous. Our well-being in this domain is influenced by our well-being in all the domains, and that's the classic determinants of health that people know about. They're all there in this framework. On the other hand, our well-being in another domain, like say social integration, is influenced by our health. If we're not functioning well mentally, for example, then our well-being socially in our family or work communities could also be impacted. And it works like that way for all the other domains. As this figure shows, well-being fluctuates across the life course over time between worse and better. It doesn't stay constant all the time. Sorry, I'm just waiting for a change here on the slide. Sorry, folks. There we go. Our identities and sense of purpose are really important to us, and they arise from factors in all the well-being domains. That's why you don't see them listed as specific domains. Social identity means our membership in a social group and the value that's placed in that membership by both the group and by us ourselves in that group. These social identities give us roles, which give us a sense of purpose. So that's the connection between identity and purpose. as well as well-being. Recognition is crucial because recognition for what you're doing and a sense of forgiveness if you think you've done something wrong are absolutely crucial for healing. Never assume, though, that we know how somebody understands recognition. For example, in the veteran world, we found when we started doing qualitative studies that the term "thank you for your service" could actually engender some very uncomfortable feelings in military veterans, even though they might be polite to us. So we have to ask, what makes you feel recognized? There's been a tendency to use these four words here, well-being, health, well, and wellness, interchangeably, but that leads to a lot of confusion. And one advantage of this well-being framework is it separates them out into these separate meanings so that they're separate from each other, where health is a subdomain of well-being. Being well, usually most people in the vernacular understand that a person is good in the health domain. And wellness is ways of living to achieve good well-being, not well-gain. Ways of living to achieve good well-being. It's not synonymous with health, it's not synonymous with well-being in this framework. So during COVID-19, what do you need for good well-being? These are the questions I think we're setting up for the panel and for you. In each of these domains, what can you and your family do? What can leaders do? What are you asking leaders to do to help your well-being in these areas? What do you want the public to do to help public safety personnel have well-being in these areas? And then what can CIPSRT do? So with that, I'm going to turn it over to the panel again, and I'm going to just leave up this last slide, which is the one you saw earlier, that just reminds you what those well-being domains are. You could take a screenshot if you want, have it on your desktop, or you could make a quick note of them if you wish. Emily?
Hi. So thank you very much for that, Dr. Thompson. I'm going to invite our panel to come back. We're slowly getting people back here. All right. So I do know a few of our people online are having a bit of trouble with sound. I apologize for that. I'm not sure why that's occurring. Please do know that a video of this will be shared after the webinar. Okay, so let's start with our first question that I'm going to go through with the panel. And that question is, what do we do to support well-being for public safety personnel during COVID-19? So Dr. Thompson, I'm going to start with you.
Well, I'm not in your world. And that's where I need to hear from panelists who are in this world and would be connected with some of those things. I'm sorry to defer it that way. Maybe that's not answering the question directly, but I'm not the expert in your community.
All right, then, Megan, how about we start with you on that question?
Sounds good. I don't mind being first up on the block here. I want to say that I will talk about kind of the way that we're supporting from a correctionals perspective well-being, but in particular I have to say that I am going to be a little biased towards the federal perspective, given that I am with Correctional Services Canada. I think as Dr. Thompson was describing, a lot of these domains do interact, and so though like many other of our first responders or public safety personnel, we do have a lot of correctional workers who are still doing well in terms of a financial domain. We still have jobs, we're still working. They do have impacts on other domains, and we'll get to that question in a bit. I will say from a national perspective, from a federal perspective, we are making sure that we're looking at the health domain, personal protective equipment, making sure we have scheduling that can limit the spread of, or the potential spread of COVID. There's lots of support from the social domain or life skills, looking at the employee assistance program, but also some of the programs that they have for managing finances during crisis, or for people who are working at home, how to work from home, maintaining social interaction. So I think there's lots of available resources that can go throughout different domains, but as we'll get to, I'm sure, of course, some of those positives, some of the programs can also have a negative influence on other domains.
Okay, thanks, Megan. Christine, let's go with you next.
Hi. So I guess some of the hands-on things that we're doing to support well-being amongst the paramedics is that we're doing daily phone call check-ins with anybody that is currently off on isolation. We also continue to do check-ins with any employees that were pre-COVID-19 dealing with mental health issues themselves. We are providing simple links to mental health services within our area to take the guesswork out of trying to find help when help is needed. We also created a private Facebook group for everybody at the service to join. And one of the reasons for that is, like Dr. Thompson was saying, is provide a purposeful meaning. And so what that group that we formed, it has kind of two main goals. Is one is what do I need help with, and what could I help someone with? So we're really focusing on people's basic needs. If someone's in isolation, they need groceries. We have another employee that's helping to get that. Childcare has been a big issue for first responders, so people are posting there, and the help is being provided. And also with housing, some of the medics are choosing to house themselves outside of their main household to protect their families from bringing anything home. So again, that's sort of something within that Facebook group that's been very beneficial. We bring forth, when I speak with people on the phone, I bring forth any issues that they may have directly to management, sort of kind of the middleman, and kind of get the word out that way. And our final thing that we're doing, we've had sort of pre-COVID-19 as well, as we have 2 dedicated phone lines that are directed to peer support members. So they're run 24/7, and you can call day or night in time of crisis, or just simply when you need to talk, and we're there to help. So it provides an outlet for someone that could be struggling.
Perfect. All right. Thank you very much, Christine. Sylvie, can I get you to go next?
Hi, yes, thank you very much. Certainly it's a great opportunity this afternoon to join you all from coast to coast to coast in speaking about some of the efforts with respect to well-being for the RCMP. Like my colleagues, a tremendous amount of effort has been made to ensure the safety of our members, ensuring that they have the proper personal protective equipment, that the protocols, processes have been well communicated throughout. But I guess key to all of this, and to resonate a little bit what I've heard so far, key to this has been communication, whether it's communicating to the boots on the ground, or it's communicating to those that are in isolation. We have worked hard to do that. Communicating essentially our programs and services available to them. And in doing so, we have operated through offering broadcasts from the Commissioner. At the beginning, they were daily, and now updates as required. Also communicating through our mental health champion. And in addition to that, I should mention we've developed in our website a repertoire of all the various services programs available. And I think what has been quite helpful to our operations is we've developed a Q's and A's section, whereby we're hearing the questions come in from the field, from the different stakeholders within our organization. And we are working as a team with our occupational health experts. We have the, I guess we're very fortunate to have a national medical advisor on staff. And also working with our chief nurse, working also with our safety officers throughout the operations at the national level to answer these questions and answers. We've also made them available on an external website, mindful that some are working from home. Listening, trying to listen as much as possible to where the needs may be it from the employee representatives, our unions. And to that, in terms of the programs being made available, we've certainly expanded with respect to the employee assistance services. The arm of that program is our peer-to-peer program, whereby during this time of COVID-19 pandemic, our peer-to-peer advisors have been very active, again, using phone lines, speaking to the individuals in need, making themselves also available. We set up a generic email box so that we don't want anyone to feel forgotten. In addition to that, we have a support for operational stress injury, our SOCI program. So our SOCI coordinators across the country have also been very active so that no one feels isolated in this time of need. In addition, we are participating in Internet Cognitive Behavioral Therapy, ICBT, through the CIPSRT, and essentially it's a pilot project in Saskatchewan, and these folks have the added benefit, those participated have the added benefit of being provided additional skills to manage depression, anxiety, and post-traumatic stress injuries. So finally, I guess my resonating message is to continue with communication in all respects, and we're certainly open to essentially suggestions as to how we can continue to improve on that, and ultimately working hard also to communicate with the families of our members, providing them with tools so that within their families they are better equipped possibly to speak with their children, because also the children are affected or are worried about the members in this time of need, worried about their health. So I'll close with that, and I'm open to some questions.
All right, Casey, I'll have you go next. Oh, I can't hear you, Casey. You're still muted. Nope. Still lost you. Okay, so maybe I'll go to Alan and we'll come back to you, Casey. Al, if you want to go.
Yeah, I can. Can everybody hear me?
Yep.
Yeah, okay, great. So going back to the original question, how do we support well-being during COVID-19 for our PSP personnel? Because the term well-being is kind of a multi-level question.
I think especially the first few weeks, communication was important, but our problems were getting so like.
Oh.
I think there's a lag there.
There is, yeah.
All right, I'll continue. So because well-being is type of a multi-level question, I spoke to many firefighters about this. And really one of the biggest ways that we can help people is asking a very simple question. And the question is, are you okay? So if we have more colleagues recognizing that something may be off with their friends or colleagues, and just approaching them and just asking them that simple question, are you okay? That's huge, because that tells the other person that, oh, wait a minute, you know what? Somebody's recognizing that I'm not myself and they care enough to ask if I'm okay. So yeah, that in itself is huge. Are you okay?
Thank you, Alan. That's a really good point. All right, Casey, do we have you again?
Can you hear me now?
I can. There's a little bit of a lag, but why don't you go ahead and answer the question?
Okay, so one of the big issues right off the bat is when we talk about communication, was there there's just an influx of communication. There's so much communication, and even when we try with our frontline members, nothing.
Oh.
Can you hear me?
We've lost you again a bit, Casey.
Yeah.
Okay, so sorry about that, Casey. I'm gonna just move on to the next question.
Am I working or no? Okay, sorry about that.
Yeah.
But it was the communication, and when we try to communicate with our members, that communication. Okay, I'll move on. I'll try something else here.
Okay. Sorry about that, Casey. All right, guys. So thank you for answering that question. So another question that we've had is for your different section, your sector, I apologize. What do you think is the #1 challenge? So I'm going to start with Megan. What do you think is the #1 challenge during this crisis for your particular sector?
The #1, I had a couple. I think what I would say is the #1 challenge for the correctional service sector is the fact that it's not just the workplace and the structure and the processes and the routines and the change in routines are not only impacting the staff, but also the people with whom we work. So a lot of our offenders as well. And that change of routine does pose an increased risk for numerous types of well-being domains. And then that increased risk can result in increased stress, which then can have a greater impact not only on potential health domains, but also social domains and with respect to working with family. So that the change in routine and the change, it's a pervasive change in routine throughout the entire sector when it comes to corrections. And I think that the impact is very, very widespread, and it just accumulates. The more change, the more time, the more work we try to do protective from a physical health, then relates to a greater change in the routines, which could then increase greater risks across the board. There's one other challenge that I think is really unique from a correctional perspective that I want to throw in there is also the multi-jurisdictional impact. So it's a really important piece from in a correctional perspective to be working substantially with municipal and territorial correctional organizations as well as federal. So all three groups have to work together to try to come up with a collaborative approach to managing offenders throughout the correctional system.
Thank you, Megan. That's really, really important. As you say about managing those different levels, that's certainly a challenge for the correctional system. Alan, I'm going to go to you next. If you could identify the #1 challenge in your sector.
Yeah, like Megan said, I mean, there are several, that's for sure. But I would say the #1 challenge is stigma, but it's not the stigma that you think right away. It's the self-stigma. Because, you know, like in my world, the firefighter world, we're here to help people. We're here to fix their issues. And God forbid if, you know, we need help ourselves. And to recognize the fact that, oh, wait a minute, we're human, we're vulnerable as well during this crisis. And then to step forward and actually recognizing it and admitting it and then seeking help. That would be one of the biggest challenges, but I have seen a change. I have seen a difference. We are breaking that barrier, but it's still that self-stigma that's the barrier.
Thanks, Alan. Sylvie, why don't you go next?
Hi, yes, I guess I'd have to echo very similarly as to Megan. We too in the RCMP operate in multi-jurisdictional with all those requirements, and from a safety perspective, what I can say, one of the worries has been to be able to have the necessary personal protective equipment available at all times across the country. And certainly to that is ensuring the necessary protocols so that they're utilized, but that has been part of some worry. And from a health perspective, there's so much information and it changes very quickly. So it's communicating the necessary protocols across the board, keeping in mind the provincial and the federal requirements, and so on and so forth. So I would say that has been some of our, I guess, challenges. But I have to echo the other stressors that the other panelists are mentioning are certainly true for us as well.
All right, thank you, Sylvie. So Christie, I'll have you speak next.
Sure, yeah, I've got a few challenges, but I think one of the biggest thing for, I think, paramedics right now is this feeling of guilt. And it's on numerous levels, and some of them being if they do become sick, they are feeling guilty that they could possibly pass this on to their friends, their families, their coworkers. The guilt of actually being off of work, either from becoming ill with COVID or any other reason that they've been previously injured, they're feeling guilty about letting their coworkers, the other medics, down, that they're not on the road helping fight the fight. There's also the guilt, sort of a new thing with patient care, is that we can no longer bring family members to the hospitals. So that guilt of leaving, let's say, an 80-year-old woman behind because you're taking her husband who just had an MI to the hospital, so that sort of that moral dilemma of leaving this poor elderly woman at home and no one's able to comfort her. And one of the big things too is with all this new recognition, it's great, but there's also a lot of guilt associated with that, of receiving like the free foods or free coffee, discounts at different stores. There are a lot of people that feel this guilt of using that, like why me? There's a lot of other people that deserve this as well. So that's kind of one of the, I'd say a big thing that we're dealing with, is always this feeling of feeling guilty about something.
Okay. Thank you, Christie. Dr. Thompson, I'm just going to go back to you and just ask a more general question about the Wellbeing framework. Noting the challenges that the other members have pointed out, what do you see as general ways to use this framework to meet those challenges?
It's interesting, there's been a lot of talk about the psychological impacts of COVID, but they come from other issues. They come from, for example, healthcare providers having to stay in dormitories instead of going home. I don't know what's happening with police officers in that regard too, but there must be all kinds of stuff going on the street around things like social distancing from their families rather than physical distancing, or physical distancing causing social distancing from family members and friends, and what are the impacts of that? What's happening around employment? Are people being overloaded with overtime, or are people actually losing jobs and losing income as a result of all of this in some way? That could be happening, for example, I don't know, in some police forces or some fire or EMS services that maybe can't afford to have staff, contract staff or part-time staff. I don't know. Are things like that happening? So going through these different domains makes me wonder about what's happening. And the other thing that I find useful about the domains of well-being frameworks is to think about the positives. Like we've heard from military people, for example, and military members who were trained in the military to be supportive of each other. And that's a huge ethic in the military. It starts in recruit training and goes all the way through. They're a stronger force if they pull together. They're out now and they're veterans, they've left the military, but this challenge is giving them that opportunity to come together and to try to help in the community. So there's those kinds of positive spins we need to hear about more about too.
Right. That's really important. You're right. So I'm just going to go through our questions here. Give me 1 second. So I'm going to ask this of the whole panel. What do you feel the public in general can be doing to support public safety sector well-being? I'm going to start with Alan. Oh, did we lose Alan? Okay, Megan, I'll start with you. What do you think that the public in general can be doing to support PSP well-being?
That's a really interesting question. And again, coming from a correctional perspective, I think sometimes even correctional staff are maybe not top of mind when you think about public safety personnel. And so I think that's one aspect to consider, is the wide range of people who are working in public safety. I think it goes back to the question that was raised earlier of what does meaningful recognition look like? What can the public do? I don't know, and I really do hope that that's some information that some of the people who are attending this webinar can respond to, is what does meaningful recognition look like? How do we want the public to support? I definitely don't have all the answers. I don't know if I have really any great answer other than to recognize that there's a wide range of people who are involved in supporting public safety throughout Canada, and I think our preferred mechanisms of being supported by the public are going to be just as varied.
Perfect. Alan, I see your back. Do you want to go ahead and answer that question?
Yeah, I'll see if I can hit the right button this time. Yeah, generally, again, speaking with my colleagues about this, the best way that the public can help, firefighters is really respecting and, abiding by the restrictions that the government has put into place. That helps us do our job better. It helps us do our job in a safer way if everybody can, put together as a team and follow these restrictions for the time being. The other part to it too is our volunteer firefighters, not our full-time, but volunteer firefighters. They have full-time jobs. They have other full-time jobs. And some of these other employers are concerned that they are volunteer firefighters and that they are increasing exposure level to themselves, and they're afraid that they might be bringing it back into their work environment or their full-time environment. So I would say is, can the other employers understand that we have a lot of safety measures in place that protect us from the exposure and protect us from exposing others.
Okay, thanks, Alan. Christine, if you want to go ahead.
Sure. I think one of the important things is just for the public to remember that we are human too. We all have families and friends, and we're going through a lot of the similar things that they're going through, and to just be patient with us. I know sometimes with all the new PPE requirements, when you're arriving at a scene, it does take longer for us to get in to see the person that's sick. So just be patient, let us get protected, and just remember that we're human too. And some of the things that have been really great is we'll see like thank you signs taped to the garage door at our bases, and that's absolutely amazing. It just brightens the day of the paramedics, and a lot of times you'll see a medic take a picture of it and post it on sort of these closed Facebook groups for the medics, and it's just amazing to see that. And that's you know, if kids are bored, have them draw some pictures and put them in the windows, and we love seeing that.
That's wonderful. That's super positive, Christine. Thank you. Sylvie, if you want to go next with that question.
Hi, yes, certainly. Again, as per my colleagues, certainly for the RCMP, it's hoping that the public will respect all the regulations, all the protocols, but maybe this is a good opportunity also to talk about the mental stress that employees are experiencing when they're required to work a lot of hours, right? Whereas others are not able to work at all due to the nature of their jobs. So from that perspective, that does bring about a certain level of stress, and you know, they're on 24/7. So it's a difficult time. And those that are working telework, you know, some can work telework, some because of security reasons cannot. So that as well upsets the routine quite a bit and puts a lot of stress on folks. So that's I guess my take from what we're understanding and what we're hearing.
Okay, thank you, Sylvie.
Thank you.
Okay, so I have a question that I'm going to ask. I'll ask Alain and then Christine. But I have a question. Says, lately there have been stories in the news about people who call into 911 and lie about their symptoms out of fear that first responders won't come if they admit to having symptoms. And so as a result, the first responders are not always arriving with PPE equipment on. Can you speak to this issue in your professions? So we'll start with Alan first.
Yeah, sure. We haven't come across that as of yet. Responding to medical calls, we don't respond to as many medical calls as the paramedics do. But when we do respond, we have very strict protocols in place that we respond in the same way for every medical call that we go to, and that is our full new PPE procedures in place. But we haven't come across that I'm aware of.
Christine?
Yeah, I think the important thing is to reiterate to the general public that if you are having the symptoms and you're being asked, don't be afraid to say yes that you do have symptoms. It just simply means that the medics will arrive with their full PPE on and be protected. So there's never any issue of that person not receiving medical care. It's basically protecting the people that are coming to provide the care. I know there is a pre-screening when they do call 911 through dispatch, and then the medics again are screening once they arrive on scene. So again, it's just making sure that the public, they should never feel afraid to say that they are exhibiting symptoms. It's just, it's a means of knowledge for us to come in best prepared to treat them.
Okay, perfect. Thank you, Christine. So Alan, this question is for you. Sorry, Al, is for you. It's from Patrick, who's a firefighter, and he wants to know what are the PPE protocols in Ottawa?
Well, it's sort of a lengthy process if we want to get into the details. But so I won't do that. But because of the N95 mask situation, the Ottawa Fire Service has made sure that the frontline hospital staff has the masks, because we do have, as firefighters, we do have a secondary way that we can protect us, and that is using our SCBAs, our self-contained breathing apparatuses, which are way above the requirements of an N95 mask. So now we are responding with full SCBA, and we've informed the public saying, listen, if we show up to a medical call wearing our SCBA, like, don't be afraid of us. It's just the same way that we respond to fires. Now we're responding this way to medical calls. And then we have a decontamination procedure after that, once we exit the scene, and we go forward from there.
Thank you, Al. The next question I'm going to aim at Megan. Would expedited COVID testing for your group aid in the battling the duress of the idea of knowing whether you've contracted or not?
I do. So gathering my thoughts here. I think the general direction across the world is the more testing, the better. And I don't think it's any different with respect to the public safety community. I do say that within institutions, because of the very closed nature of how people live and work, the testing is important. More important than that, though, is the contact tracing. And I know that Correctional Services Canada has recently put in very strong contact tracing so that as we see either inmates or staff becoming tested positive, we can put in isolation or either self-isolation or isolation within the institutions people who may have been in contact, so we can limit the spread as much as possible. So wide testing is absolutely going to be important, but so is that that contact tracing, which I think CSC is doing a great job at implementing.
Perfect. Thank you, Megan. All right, so I'm going to aim this last question at Dr. Thompson, and then we're going to go ahead and get some final thoughts from you guys. So this question, Dr. Thompson, is, could the well-being framework be used to try and impact change in our organizations? And could it be more effective than focusing mainly on just talking about mental health?
Well, I think it's really important to do more than just focus on mental health. And that's the lesson we learned in the veteran world, for example, that first of all, people's mental health is affected by what goes on in these other domains. But if you're interested in an employment issue or a financial issue, then we need to think about what the determinants of well-being in the employment area and the social integration area and the financial area are. They may have nothing to do with health. They could be other factors entirely. So my answer is yes, in general, it would be, I think, very useful. But of course, that's up to you folks to tell us whether it's useful or not.
All right, thank you, Dr. Thompson. Okay, so I'm just going to go through and get some final thoughts. Sylvia, I'm going to start with you, if you want to give us some final thoughts on well-being.
Yes, thank you very much. So certainly we've worked hard pre-pandemic in terms of establishing workplace well-being strategy aiming to improve mental health and overall well-being. So that predisposed us with a number of programs. But if I had, I guess, some closing remarks, I think now while we get ourselves through this pandemic, I think we need to turn our attention from a mental health perspective, looking at post-pandemic, because certainly there are those that are suffering now, and I think there's going to be residual effects that we're going to have to deal with as we look to reintegrate our workplace. So this is something that we aim to bring our attention to, and again, we're very fortunate to have psychologists across the force, so engaging also with our psychologists to start planning our way forward in that respect.
Okay, thank you, Sylvie. Megan, why don't you go next?
Sure. First off, while I close off, I just want to say thank you for having me and to all the panelists as well. It's been really interesting to learn from everybody while I've presented some thoughts. To close off, I wanted to say that I'm really encouraged by a lot of the support that I've seen, not just amongst the correctional staff, but also amongst all public safety personnel and professionals, as people really do support each other and figure out a way to work through this pandemic. I also am really encouraged by the different types of innovations that we're seeing, whether it's to advance programs or to do in institutions program delivery, to maintain a sense of calm, for example, in correctional institutions, and to allow public safety professionals to be able to communicate with their families. So whether they work in the institution or not, and maintain physical safety even. So I'm really encouraged by all these different approaches to innovation and how we can continue to do our jobs using different types of tools. I think it's really interesting and exciting to see all these different approaches. And I think using some of these innovations also does go back to that idea of purposeful activity and coming up with ways to really improve all of our jobs long term.
Thank you, Megan. Casey, did I hear that you were there? Oh, no, I guess not. Christine, we'll go with you next.
Sure. I think one of the things we did a lot pre-COVID was, making sure that everybody had positive coping skills or good coping skills. And a lot of those things now have been kind of altered. So, someone that may have had a coping skill of either like traveling or physical activity, hanging out socially with friends and family, has now had to alter that. So it's just, allowing people to say that it's okay to make these changes. You might not be able to go hang out with friends and do all these running groups, that kind of stuff, but just to try to maintain some of those coping skills as best you can, either through a new app to work out, downloading different WhatsApps and house parties and that kind of thing to still have that social connection with each other. And one thing that a coworker always says, and it's big, is just be kind to one another. It's as simple as that. If we can all just be kind to one another and help each other out, we're all going to get through this.
Thank you, Christine. Al, I'll go with you next.
Yeah, thanks. Going back to the well-being and the 7 different domains of well-being, it's a big question when you ask that. But for us, like for the firefighters, I think education is really the key. Educating them about what is well-being, and what is that level of normalcy, and is it okay to be not normal in a certain circumstance? Well, yeah, it is normal to be abnormal, considering the circumstances or the situations that you're in. So really getting the resources out there, and true vetted resources and simple resources, straight to the point resources that we can access and educate our personnel so we can help them through what they're going through now, or preparing them for what may come.
Okay, thank you. All right, Dr. Thompson, I will give the last word to you.
So 2 quick things. One, first of all, Emily, I hope there's a chat stream where people have asked questions we couldn't get to, and I'd sure like to see those. I think the other panel members would as well.
Yep.
And the last thing I'm going to do is I want to ask a recognition question of people. Does it work for you that we stand on our porches at 7 o'clock at night and bang pots and pans? Or would you rather sleep to get ready for your night shift?
All right, Alan, if you want to answer that, you can.
Sure. I don't mean to necessarily speak for all firefighters in our service. I'm sure there's different ideas out there for sure. Recognition, like you said, it can be positive, it can be negative. But a simple, thank you is lots. I don't think we need the people, bang their pots and pans. I don't think that's what we're looking for. I mean, it's appreciated, but it's not what we're looking for. Simple thank you in the street is lots, and that's even that, is fine. But if the public wants to do that, well, maybe it's okay for the public to do that because it brings the public together, and that's a strength in community, for them to come together in a unified response. So that's fantastic to see as well.
All right, Dr. Thompson, do you have anything to add? Good.
I'm done, thanks.
All right. So hopefully you guys can all see the screen I've put up. We want to let you know that there will be a brief survey that's going to pop up after you're done the webinar. We really encourage you to answer the questions of that survey, as they're going to help us inform our next webinars. We also want everyone to know that a video of the webinar you watched today will be sent to you in a follow-up email tomorrow. Please consider joining us for next town hall, which is going to be on Tuesday, April the 21st. We are going to be looking at issues around moral injury. If you have any other questions you would like answers to, please submit them to the email that's displayed on the screen. That's COVID-19 at CIPSRT. That's CIPSRT-ICRTSP.ca. Hopefully I said that slow enough. Anyway, I want a big thank you again to Dr. Thompson and our panelists. You were all great. Thank you for your time. I know it's really valuable at this point. And thank you to everybody who tuned in, asked questions, and we hope you enjoyed the content. Everybody have a great day.